Well, a headache that you're certain is a brain tumour, and you freckle on your arm that's the beginnings of skin cancer. Many of us have probably experienced the panic when, after searching online, seemingly innocent symptoms spark thoughts of dire health conditions.
Alarmingly, research shows 90% of patients admitted to hospital have Googled their symptoms before they talk to a doctor. So what are the dangers of relying on the World Wide Web to self-diagnose?
We've all done this right. For more, we welcome back Dr. Preeya Alexander, live from our Melbourne studio. Good morning to you, Preeya.
Morning.
Talk us through the downside, please, of Googling symptoms and then, diagnosing yourself.
Look, one is that it can generate a lot of anxiety, so you can really go down rabbit holes, find all sorts of diagnoses for that headache or that cough that you've got. The other one is misdiagnosis. And so you go to Google, you chuck your symptoms in, it gives you a diagnosis, and it might be the wrong one, which means that you take more time coming to see me, your GP, so it's a delayed presentation and it can often be harder to treat. I think the thing I see most commonly, though, is that it generates a whole heap of anxiety.
OK, how can you then safely Google your symptoms?
Look, I don't know if you can, Kylie, if I'm being completely honest. I don't know if you can safely do it. But I think, first of all, acknowledging that nothing actually replaces a consult with a qualified health professional like your GP. So you might use it as an adjuvant. You might say, look, I might just have a quick look online before I go and see my GP next week when I can get an appointment or when I'm free. I think the other thing is, if you're going to Google, go to reputable sites. Go for major medical bodies or hospitals where you know the information has been reviewed by qualified health professionals. It's probably more reliable. That's probably a safer way to do it.
OK.
This is only going to increase now, this activity with the cost of living crisis, ambulance ramping incidents, all sorts of things lead to this, right?
Absolutely, and I think we need to acknowledge, for a lot of people, going to see someone like your GP isn't as easy at the moment. That can be, as you've mentioned, Larry, the cost of living crisis. We know also the out-of-pocket cost to go and see your GP is also increasing, and that's because of the Medicare rebate freeze, that it hasn't actually gone up with inflation over the years. So there are lots of barriers, but I would say to people, whilst Googling can be so tempting, and I've been there, I've wanted to do it myself when I was a med student, when I was, before I had all the knowledge I have now. But Google cannot counsel you like a qualified health professional. It can't pick up the nuance in the consult. It can't see the look of concern on your face, hold your hand metaphorically or physically if you need it, examine you. It can't do all that stuff, and so it's not a replacement.
OK, so there used to be a thing called hypochondria. Now it's morphed into something called cyberchondria. What are some red flags that you might be a cyberchondriac?
So cyberchondria, Kylie, is this kind of term that's been coined for people who go online looking for medical information, and it generates more and more anxiety. And despite it generating more anxiety, people get kind of caught in this loop of Googling further and further. So it's not actually a formal psychiatric diagnosis that you might find in the DSM, the psychiatric manual, but it is certainly a term that's now been coined. Red flags are basically that you're finding it really hard to stop yourself from Googling these symptoms. And despite the fact that you continuously are Googling or searching for stuff, it's not actually alleviating the anxiety. In fact, it's driving it. So those are the kind of red flags to look for.
OK, now some people say they read about a possible illness, then experience those symptoms. Is that like a legitimate thing? As a GP, that's really got to be concerning for you to hear that.
Absolutely, and the brain is so powerful. We know this. We know if you've got uncontrolled stress or anxiety, we know that people can get gut symptoms. We know that the brain is powerful enough to cause things like chest tightness, trouble breathing. And so, yes, absolutely, if you are feeling stressed and worried and anxious, it can generate physical symptoms, and that can be really problematic.
OK, all very good information. Dr. Preeya Alexander, thanks for your time this morning.
Thank you.
Thanks.